Our glute focus flow, so you're going to need a small glute resistance band and a light weight. So you can lie backs. Just getting the video right. Okay. So, lay on your backs, feet hip distance apart. So again, we're just going to work on our connection, our posture and breath first of all. So get your feet hip distance apart, and we should be feeling connection underneath of both our feet, underneath the lumbosacral junction, TL junction, both shoulder blades and the back of the head. So we'll start with our feet and we'll just shift the weight from side to side, because we want to feel nice and balanced underneath both feet, so we should be feeling that connection equally underneath both feet. So just shift the weight from side to side until you can feel like you've got better balance between the left and right foot. And then you're going to think about whereabouts on your foot you're feeling that connection. So are you feeling it on the outside or the inside of the foot? If it's feeling equal from side to side, then that's fine. But if you're feeling it more on the outside, we're just going to start by trying to pull that inner arch down towards the floor without lifting the outer arch. So try and keep the ankle in a neutral position and your knees pointing up towards the ceiling. If you're feeling it more on the inside of the foot, you're going to try and pull the outside of the foot down towards the floor, but without lifting the inside. Okay, so now we've got better connection underneath both our feet. Work your way up to your lumbosacral junction. So we're just going to start by peeling the spine away from the floor, and we're going to be going into an anterior pelvic tilt, and then you're going to reverse peel and go into a posterior tilt. And you're just going to alternate between anterior and posterior. So lumbar extension, so peeling the spine away from the floor, and lumbar flexion, reverse peeling it into the floor. So rocking forwards and backwards until you find the midpoint between the two end ranges. So with that, your lower back should be flat on the floor. It shouldn't be indented into the floor, it should just be so that there isn't a gap between your back and the floor. And your pelvis and your lower back will be in a neutral position, and your lumbosacral junction will feel better connected. So then we're working our way up to the TL junction. So think of the pelvis and the rib cage like the pages of a book. So we want to make sure that the pages are closed, so the rib cage and pelvis are parallel. We want to try and avoid this open book appearance where we get the rib flaring and the lumbar extension. So we're going to pull the pages together, and you should feel a bit better connection underneath your TL junction. So then we're going to work our way to the shoulder blades. I was just about to miss the shoulder blades then. Shoulder blades, so they want to feel equal from side to side. So again, you're going to shift the weight from side to side until you can feel that there's more balance between the left and right. And then the shoulders themselves, try not to let them lift toward the ears and be in this anterior, internally rotated position. So we're going to try and pull them back slightly, retract them, but not pin them down into the floor. So you don't want to pull your shoulder blades together, but we want to try and pull the shoulder blades down towards the back pocket and externally rotate the shoulder at the same time, pulling the shoulder into the neutral position. And then we're going to go to the back of the head, so we're going to push the head down towards the floor, activating the muscles at the front of the neck Try not to let the neck extend or go into a neck flexion position. So straight back down, eyes looking up towards the ceiling. Right, so put one hand on the chest, one hand on the tummy, and we're just going to get the breath in the right order first of all. So think about your breath and which hand is lifting on the breath in and which hand is lowering on the breath out. So it should all be happening from this hand on the tummy. There's nothing should be going on in the chest. So really try and visualise what's going on. Try and think about lifting the hand on the tummy with the breath in and lowering with the breath out. Breathe in through your nose and out through your mouth with pursed lips like you're blowing through a straw. Let's do a couple more breaths. Then when you've got your breath in the right order, you're going to put your hands around your waist. Try not to let the shoulders push forwards. Try and keep them neutral. And we're going to now create our 360 breath. So when you take your breath in, you want to feel all the muscles expand around the abdominal wall. And then relax on the breath out. So if you're struggling to feel those muscles, if you just cough, so hands around the waist and just cough quite loudly, quite a strong cough, and just feel the muscles expand as you're coughing. And use that as a bit of a wake up for your brain to let your brain know where the muscles are. And we want to feel them expand equally from front to back and from side to side. So if there's a bit that you're struggling with, just focus a little bit more on that side. Give the muscles a poke and a prod just to wake them up a bit more. Just a couple more breaths. Okay, once we've got the 360 breath, we're going to work on our brace. So when I say brace, I don't want you to clench or tense, I don't want you to pull your belly button in. So you're going to breathe 360, creating that external outward pressure. And then before you take your breath out, you're going to create that feeling like when you're about to fart. So an outward push with the muscles. And then don't let the muscles completely relax as you're breathing out. The tummy doesn't want to be tense, so you don't want to be clenching the abdominal wall, you don't want to be sort of seeing your six pack. This is an outward pressure, so we're creating a nice smooth cylinder the whole way round. Keeping those muscles active as we breathe in and as we breathe out. So this is a brace breathe. So when we're doing things that need more stability, we need to be able to create this brace breathe, not hold our breath as we're doing it. That only comes when you're doing your really, really heavy 1 rep maxes. Couple more breaths. Okay, so get your band and then put it around your knees. So try and get it on the outside of the knees, and then we're just going to put our feet back down in a position where there's a bit of resistance, so you don't want to be where there's no resistance in the band at all. And then we're just going to start by just keeping the pelvis in neutral and in the neutral position and the lower back in a neutral position. We're just going to start by taking one leg out to the side. So you're externally rotating the hip, and then let it come back in, and then take the other leg out, and then bring it back in. Take the opposite leg. So just alternating sides at the minute, really concentrating on the external rotation in the hip, so using those muscles in the bum, the external rotators, to create that movement. Bringing the knee back up to the middle. And then you're going to do both legs, so we're taking both legs out to the side. So just do this nice and steady, so we're not rushing the movement. Do a couple more. And then we're going to do some glute lifts. So we're going to peel the spine, or reverse peel the spine into the floor. So we're going into a slight posterior pelvic tilt. And then we're going to use the bum muscles to lift the bum off the floor. So the feet and knees are still staying in a position where the band is got some resistance, and then you're going to lower your bum back down. So you're going to reverse peel the spine down towards the floor slowly, and then don't let the pelvis tuck into this anterior tilt when you come back onto the floor. So we're going to keep in a neutral spine when we're on the floor, but then tilting slightly posterior as we lift, and then peeling the spine off the floor, using the bum muscles to lift up, and then slowly lower down, reverse peeling back into that neutral pelvis position, and then again we're going to lift up, and then lower down, and lift, down. Then with this next one, we're going to lift up, so posterior pelvic tilt, lift the spine off the floor, and then externally rotate both hips, and then lower back down, and then back up, and legs out to the side, so externally rotate the hips, and lower back down, and up. So just do this in your own time, nice and steady, don't rush it. Keep breathing, keep focusing on your 360 breath. And then with this next one, we're going to lift up. And then what you're going to try and do is create your 360 breath and your brace, and we're just going to extend one of the legs. So we're stabilising on the opposite side. So you'll feel that glute on that side that's stabilising. And you don't want to let your pelvis drop on the side that's extending. So the pelvis wants to stay level. And then lower back down. And then come back up. Create your brace. Extend the opposite leg. And then down. And again, just in your own time, lifting, extending one leg, trying to keep that pelvis level. Keep going, we'll just do another couple. So just do one more on each side. And then we'll just do some single leg lifts just to sort of warm up the movement. So we're going to lift one leg and lower back down. Lift the opposite leg and back down. Trying to keep the pelvis in that neutral position, neutral lower back. So this is where the band needs to be around the outside of the knees rather than a bit higher up, because it will just ping up your legs if it's a bit high. Like it's doing on mine. And then we'll go into the double leg lift. So create your 360 breath, create your brace. Make sure your pelvis stays in that neutral position as you're lifting up. And then lower back down. And lift up. And back down. So as we're lifting the legs, create some external rotation and abduction in the hip. This hip flexion is a coupled movement with external rotation and abduction, and then when we lower back down, we're just going to take them back into a neutral position. If this is too much for your back at the moment, just keep to single leg lifts. And then we're just going to take our legs up into 3 months supine. Again, if it's too difficult to hold this position without legs being supported, just get your legs propped up on the sofa or on a gym ball or something like that. Just hold that position. And then just take one leg out to the side again. So we're going to abduct the hip. And then bring it back in. And then the opposite leg. And bring it back in. So single legs at the minute. Keeping that neutral pelvis, neutral lower back. And then go from single leg into double leg. Let's do a couple more. Bring your knees in, just give your hip flexors a little bit of a rest from being in this position. And then we're going to keep the band on when we do the roll. So keep the hips in external rotation and abduction, hands up to the ceiling, fingertips pointed up to the ceiling. Lift your head slightly and then you're going to look to the direction that you're rolling to. And we're going to roll over nice and slow. Really, my head's not in view. And then we're going to roll back. And roll onto the opposite side. So when we're rolling, try and make sure your pelvis and your shoulders move at the same time. So you've got your Lego body, so that your pelvis and shoulders and ribcage don't disconnect. Nice and controlled, so try not to let yourself flop down or throw yourself back up. Try and make sure your spine is nice and straight as you're rolling onto your side, so don't let your spine banana, so you want to keep a gap here. And then we're just going to finish off up onto a lower oblique sit. You can get rid of the band for the time being. And then you're going to put both hands on the floor, so this lower oblique twist, as I call it. And what we're going to do is we're just going to lift the bum off the floor. So lift and lower. And lift and lower. So keep both forearms down on the floor at the moment. So we're using that bum cheek on the floor to lift and then slowly lower down. Do one more in this position, then we'll go into just the lower oblique sit. So take one hand off the floor, and again we're just going to lift and lower, lift and lower. So keeping that shoulder active, don't let the shoulder shrug. Nice and slowly, just in your own time. And then come up onto the hand. And again, we're going to lift and lower. Keep the spine nice and straight, don't let yourself banana. And then we're going to go into the oblique sit lift. So we're going to hinge forwards and then slowly lower up and lift up. Oh, hang on 1 second. Just need to let Rachel back in. Okay, so keep going with those. Hi! So we're doing some oblique sit lifts at the minute. So get into your oblique sit and then we're hinging forwards and slowly lifting up. And then slowly lower down. So don't let yourself fall and collapse down on the floor, because otherwise you'll just end up hurting your knees. So lift. So if you're struggling with this movement, get yourself something underneath your bum to lift you up a little bit. So you've not got as far to lift and lower. And then if you can, if you're finding it nice and easy, grab hold of your light weight and then lifting up and slowly lower down. And I can feel that burning in my bum at the moment. Just do another couple. And then put the weight to one side. And then we're going to do some oblique sit lifts into a high kneel, but really nice and slow and controlled. So it's lifting up and then try and bring that leg forwards. And then slowly, this is where I might fall, bring the leg back and slowly control. So we're really I'm using my left side to really stabilise my hip and pelvis at the moment. So lower down and slowly lift up and bring that leg forwards and then slowly lower it back. Really slow and controlled movement. If you rush it, you'll just end up losing your balance. Keep breathing, don't forget to breathe, which I always do because I'm just talking. I lost my balance then, so I need to breathe and brace. And then just do one more. And then lift up into the high kneel on that side. And we're just going to get our pelvis into a neutral position. So level with the floor, neutral spine, foot not too narrow, foot out to the side. And we're just going to lean into that front leg. So if your pelvis is level with the floor and in a neutral position and your pelvis isn't twisted, we'll hopefully feel that right, or whichever side the leg's forwards, hopefully you'll start to feel something happening in that bum muscle. And then from this position, like mine's just started to kick in now. Curl the back foot under and then stand up and slowly lower down, making sure the pelvis is level with the floor every time. Slowly down, pelvis level, Make sure the knee's tracking second and third toe. If you need to hold on to something to give you a bit more balance so that you can keep your pelvis level, get a chair or something next to you. So it'll be on the side where the knee is back. And then if you can, but only if you've got your pelvis nice and level with the floor when you're doing this, you can add a little bit of weight. And slowly, so really concentrate on that slow descent. Every time, reset the pelvis. Just do one more. Put the kettlebell down, then create that stabilisation on that back leg. Bring that leg back, the front leg back, sorry. Slowly lower down. Then we're going to rotate the opposite direction. Down onto both our forearms. So in this lower oblique sit twist, and then we're just going to lift and lower. So lifting and lowering. Keep the shoulders active, try not to let those shrug up. Just do one more. Come up onto your lower oblique sit, and then you're going to lift. So forearm flat on the floor, but just on one hand, one forearm this time. And we're lifting and lowering, lifting and lowering. So really using that bum cheek, all the muscles in that lower bum cheek to lift and lower. Again, keeping the shoulder active, don't let the shoulder push forwards. Keep the spine straight as much as you can. And then come up onto your hand. So into high oblique sit and lift and lower. Keep the hand nice and flat on the floor. Think about that hand connection as well when you're doing this. One more. And then I'm going to turn around. So we're going to go into our oblique sit lift. So again, slowly lift up and slowly lower down. Slowly lift. Slowly down. If you want to add the kettlebell or the light weight, grab hold of that and lift and lower. Careful with your knees, don't land too heavily Make sure you've got a little something underneath your bum if you're finding it too difficult to lift and lower without collapsing into it. Just do one more. And then put the kettlebell down. Then we're going to lift. And again, we're going to use now the opposite side to stabilise as we bring one leg round into a high kneel. And then really stabilise as we're bringing the leg back and slowly down. And up. And down. So just in your own time. Coming up and down. And then you're going to lift up into your high kneel. Pelvis level with the floor, neutral spine, neutral pelvis. Create that external rotation in the hip. Knee tracking the second and third toe. And then just lean into that front foot. Try and see if you feel anything in your bum. So mine's starting now. And then curl the back foot under, lean into it and stand. Create your balance. Slowly lower down. Keeping that knee tracking the second and third toe. Try not to let it cave inwards. Try and keep that balance, that pelvis level with the floor the whole way up and down. And then if you want, you can add your weight to it. Again, making sure your pelvis stays level as you're doing it. So really control that movement. Don't rush it. Make sure you're not too narrow with the legs. So when you're taking the back leg back, make sure you've got enough space so you don't bring it right back too narrow. Okay, just do one more. Down. So then we're going to go back down into an oblique sit. So we're going to bring that front leg back, slowly down. And then bring the back leg in front of the front leg. Then we're going to lift the bum in the air and rotate round into bear. And then you rotate round the other way. Lift, rotate round. Make sure you have your Lego body when you're doing this. So pelvis and shoulders rotate at the same time. So really slow and controlled. Don't rush this movement. Make sure your hands fully connect with the floor. Don't make them have them clawed hands. And then just come up, go into your bear, into your quadruped position. And we're just going to do some hip extensions. So you need to find your neutral spine. Make sure your upper back's nice and long and it's not rounded. Push the floor away, so we're activating the shoulders. And then we're just going to take one leg back and then pull it back in. And then the other leg back. So again, what you want to make sure you're not doing is extending through the lower back as you're taking the leg up. So you only want to take it as far as you feel like you're keeping a nice neutral spine. So alternating legs. So the way to create balance in your body so you're not wobbling all over the place is to, when you're taking your right leg out, transfer the weight into the right hand and the left knee. So push the floor away with the right hand and left knee, and then you can take that right leg back. And then the same on the other side, so push into the floor with the left hand and the right knee to take that left leg back. So then with this next one, we're going to take the leg back and then try and just extend the hip a little bit more, so we're getting a bit more glute activation, but make sure you don't just drop into the lumbar spine. So hip back and try and squeeze that glute a little bit more into extension. Keeping completely neutral in the lower back and pelvis. So keep alternating sides, nice and slow. Keep resetting your pelvis and spine if you need to. Just do one more of these each side. And then what you want to do, we're going to do the fire hydrant, or the leg cock. So take one leg out to the side, and then the other leg out to the side. Again, keeping neutral position in the spine. So alternating sides. And then you can kind of mix the two together. So take one leg out to the side and then extend the hip and bring it back in. Opposite leg and bring it back. So switching sides, keeping your pelvis in a neutral position, lower back in a neutral position. Okay, so then we're going to go into our bear. So lift the bum in the air, and then we're just going to hinge the hips backwards, and then walk the hands back into your squat, and then stand up. You want to put the band around your knees that external rotation in the hip. Neutral spine. Slowly lower down and back up. Slowly down. Having a feel of what your pelvis is doing as you're going down and coming up. Make sure you don't lose the pelvis and spine. Let's do a couple more of these. I'm very nearly done. Just going to do a little bit single leg work. So this is where I go horribly wrong because I've got awful balance. So if I fall over, don't laugh at me please. Right, so we're just going to do some single leg standing. So get yourself into comfortable foot distance apart, and then try and just create your brace, and you're just going to lift one leg. Try and get your hip and knee to 90 degrees and your foot at 90 degrees as well. And just hold that position. And then down. Same on the other side. Trying to keep the pelvis level with the floor. So stabilising through that supporting side. So obviously depends on how good the stability in your ankles is as well. So slowly down. So just in your own time, just do a few single leg lifts. Trying to stabilise on that supporting leg. Keeping the pelvis level. And then, last thing, I want you to find your neutral spine, take one leg slightly backwards, so we're sort of hinged at the hip a little bit, and then what we're going to do is we're going to create external rotation in that support leg, and then rotating inwards. So externally rotate, and then down in and out. So keep that front knee pointing forwards. So we're externally rotating on that hip. So we're not actually externally rotating the leg outwards. We're creating external rotation by tilting our pelvis around and then down. And you should start to feel that supporting bum muscle working. Let's do a couple more on this side. Oh, my bum's really hurting now. Swap sides. And do a few on this side. So that leg, back leg back, supporting on the front leg. Create your neutral, make sure you've got a bit of a hinge, and then we're externally rotating on that hip. And then internally rotating. Last little bit this is, not long to go. Do a few more. Last one. Okay, so that's all